Good afternoon. Welcome to Navigating Medications and Alpha-Gal Syndrome, hosted by the Vineyard Haven Library and the Martha's Vineyard TIC program. My name is Liz Schick. I am the adult program coordinator at the Vineyard Haven Library, and joining me is Patrick Roden Reynolds of the Martha's Vineyard TIC program. Our presenter today is Dr. Sachin Shah, pharmacist and CEO of VeganMed, dedicated to improving transparency and patient safety. Dr. Shah earned his Doctor of Pharmacy degree from the Massachusetts College of Pharmacy and Health Science and is currently a professor of pharmacy at the University of the Pacific in Stockton, California. Dr. Shah has published over 100 scientific works, generating over 1 billion media impressions in outlets such as NPR and BBC News. VeganMed, which is soon to be changing its name, and we will hear about that in a minute, is committed to improving transparency in medication labeling to ensure that everyone knows exactly what is in their medications. Its mission is to make medications safer, kinder, and more inclusive, especially for those with allergies, religious restrictions, or dietary preferences, so that everyone can make informed choices with confidence. So over to you, Dr. Shah.
Thank you, Liz, for the very kind introduction, and what a pleasure to be here. I almost feel like I'm back in school in Massachusetts going through the pharmacy program, just speaking with your group. So thank you very much for the invite. Today, as you very nicely introduced, we're going to be talking about medications in the setting of alpha-gal syndrome, a very important topic. And as you said, I had founded VeganMed and VeganMed Foundation to solve this problem, and excited to share today for the first time that we're now going to change the website to pillclarity.org, because I think it's a little bit more inclusive and it better describes what we're doing, which is providing clarity around medications. But, let me start with a few disclaimers, if you don't mind. One is everything that I'm going to be talking about is my own opinion and is not necessarily medical advice. The second is that I'm not going to be answering any individual drug questions. For that, I recommend that you go to our website and ask, because it's a little bit more complete and robust of an answer. But I will talk about general lessons and classes of medications as a whole for sure. Of course, I will not be able to cover everything within this time frame, so I do want to say that up front. And I am not promoting or endorsing any particular product or a company, nor am I here to discredit any company or product as well. But I just want to put those disclaimers out there up front. But that being said, let's see if I can move the slide forward. Okay. Well, I want to acknowledge this very foundational single slide graphic that talks about alpha-gal syndrome as a whole, because I understand that there might be people with different backgrounds on this webinar. So alpha-gal syndrome, also known as a red meat allergy, as a result of a tick bite, most commonly the Lone Star tick, but there is two other ticks that have recently been suggested to also cause alpha-gal syndrome, which is the black-legged tick and the western black-legged tick. But the Lone Star tick is the most common. And then once this tick bites you, within weeks to months, you develop an IgE-mediated allergy to any mammalian products, as seen in the graphic in the middle. So essentially, when you expose yourself to any mammalian meat, dairy, gelatin, or any kind of mammalian-derived product, you can have an allergic reaction. That, interestingly, reaction can manifest in hours, and it's a delayed reaction. And some numbers that are thrown around are actually anywhere from 2 to 8 hours after you get exposure to a mammalian allergen. Now, the phenotype of the reaction actually has two styles. One is the classic hives, itching, and swelling, and/or anaphylaxis. But there is a cohort of patients that also have only abdominal symptoms with nausea, vomiting, and diarrhea, plus or minus the anaphylaxis. So my point here is, if you don't have the classic hives and itching, Please be mindful that some people only have the GI symptoms, and you still need to look into observing what you might have exposed yourself to. May that be in the form of food, or may that be in the form of medications. Now, this graphic is from Alpha-Gal Information's website, AGI, and I think they provide a incredible resource for everybody that has alpha-gal syndrome. And every person out there with alpha-gal syndrome should know this website, which is Alpha-Gal Information. And of course, today's session is not about the diagnosis or talking to your doctor about it, but I want to acknowledge the founder of Alpha-Gal Information and Alpha-Gal Alliance Action Fund, Sharon, was here before, with also the founders of Alpha-Gal Foundation, Debbie and Candice, who did a phenomenal talk on how to talk to your doctor about alpha-gal syndrome. And you can look this up on the website, and that talk is there. But they did a great job, and I encourage people to listen to that in terms of engaging your healthcare provider. But what we're going to talk about today is only the medications piece of it. So that being said, the organizers of this webinar asked people for any thoughts or comments, and they got this one comment, which I think captures the essence of the problem really well. I'm going to read it. So it reads, how do we find prescriptions needed if doctors won't even do any research on what's safe? Is there a site that they can look at? They have no idea that I've found, and the person has found that getting meds, the most difficult aspect of having alpha-gal syndrome. You know, several providers might just say, hey, they have no clue in terms of what to prescribe. Just come back in 90 days and we'll see how it's going. Even if they get a liquid form, which people think might be different or better, the pharmacy may not carry it, or the insurance may reject it because it's meant for children. So this is the comment, and I think it displays the frustration that many have around finding the right medications in the setting of alpha-gal syndrome. So for that reason, we started a very passionately and service-oriented company, Vegan Med, which is now, like I said, pillclarity.org. And if you take away nothing from what I'm going to say, please take away this website, that when it comes to medications and your condition, in this case, alpha-gal syndrome, this is a resource for you, freely available and ready to serve. So this is a key highlight for you to kind of commit to memory as a resource for you. But of course, we're going to get deeper into the topic as well. So what I did is I summarized in a little image what was described earlier. And essentially, the process is your provider will prescribe your medication. And yes, that can have its own share of challenges. I acknowledge that. But the prescription goes to the pharmacy, or the pharmacy in a hospital or the hospital setting, and it is there for processing. Now, to that pharmacy, the medications come through the pharmaceutical manufacturer, maybe through different routes, through a wholesaler or something like that, but ultimately it comes to the pharmacy. And the pharmacy at the same time is engaging with the patient's insurance plan to ultimately give the patient that the medication was prescribed. So hopefully everybody can see this simple schematic, and now we're going to slowly build on this. The way to build on this is to actually use an example. So in this case, I have the provider prescribing Lipitor, which is a common cholesterol medication. At one point, it was a top medication prescribed, still is in the top medications, but there are others now. But that is a brand name. Now, let's say the doctor prescribes Lipitor, and that will go to the pharmacy or the hospital pharmacy. And believe it or not, there is 20 to 30 different manufacturers of that generic version in the country, as depicted by the different colored bottles on the top right. But the pharmacy is actually only going to carry a few of them, as depicted by the green and the black bottles sitting in the pharmacy. And that is because of pricing or their formulary, who they are partnered up with is their preferred provider of that medication. So sometimes when you're not getting your medication and the pharmacy refuses to fill it, it might be because of that reason. Now comes in the insurance plan in this program. And what happens is the insurance plan may be giving the pharmacy a specific amount, regardless of which manufacturer they give to the patient. So it's possible that some manufacturers are more expensive for the pharmacy and they lose money, but their preferred ones, they might be making a little bit of money. And this is how the dynamics of the insurance, the manufacturer, and the provider all connect with the pharmacy. And in this scenario, I had mentioned that Lipitor is a brand name, but atorvastatin is the generic name, as you see on the far right, which is what the patient ends up getting. So there is a rule that when a brand name is written, the pharmacy will typically change that out and give the generic version because that is cheaper for the system as a whole. But the active ingredient of atorvastatin and Lipitor in this case is the same. So you should expect the same benefits. The inactive ingredients could be different. Okay? So this is at a high level the flow that I want people to acknowledge and understand how the dynamics works. Now let's build on this some more and give all of us the tools to how to navigate this scenario. And remember the real case of somebody's words that I shared as I'm going through this. So the first three-letter word that I want people to take away is DAW, which is dispense as written, or sometimes they'll say DAW1. What that means, this is a tool that I'm giving you that you should have in your toolkit, that when you're talking to your provider, of course, have a good relationship, acknowledge that this is putting more workload on them to figure out which medications are suitable for you. But if you can figure out which medications are right for you, the provider can write these three magic words, dispense as written, and then the pharmacy gets a signal that, hey, I need to give the exact medication that the provider has prescribed, and I cannot switch it out, like the case I was saying that Lipitor, they would switch out to atorvastatin type of a thing. Here, whether it's the brand, generic, specific code that they write on it, they need to dispense as the provider intended to write it. Okay, so this is a little tool that you can be aware of, and you can talk to the nurse practitioner, the nurse, the provider to try and help you navigate identifying medications. Of course, when you're communicating with PillClarity, our pharmacy team will also give you certain codes that will help you identify exactly which medication you should be taking. Okay, but dispense as written is one thing you can take home today. The second is patient advocacy. Oftentimes, the pharmacy should be helping you in trying to figure out if there is any animal-derived ingredients. That's what ADI means in your medication. And remember the example I gave of atorvastatin or Lipitor, that there are 20 to 30 generic makers of that drug, and everybody could have different inactive ingredients. And hence you need to check, are there any animal-derived ingredients? And in the specific case of alpha-gal syndrome, you're literally looking for mammalian-derived ingredients, but as a broad spectrum, I'm saying animal-derived ingredients. So now the pharmacy can help you, or even the pharmacist in our group, PillClarity, can help you, and you can speak to your pharmacist and say, hey, I have found a particular medication, or can you help me check? What happens is now the pharmacy will check, and they might have to order a different drug as depicted in the teal bluish color that I've brought into the pharmacy. So they might have to order that drug, and that might add more time. Unfortunately, some pharmacies may not even fill this because they might be losing money, and they might not be able to or willing to fill that for you. However, I want to say that there are many pharmacies out there that are very nice. They understand and they want to do right by the patient, and they will fill the prescription for you even if they're losing a little bit of money on it. Okay. So knowing animal-derived ingredients and recognizing that the pharmacy has to put in a little bit more effort in identifying the right meds, and you talking to the pharmacy in understanding that process will help you win that scenario. And of course, you can reach out to PillClarity to help you out as well. The last three word acronym that I want you to take away is NDC. NDC is National Drug Code, and every drug or medical products will have this. And it's a unique identifier because remember, the word atorvastatin is a generic name and it is not unique. You can have many manufacturers of that. But an NDC number is very unique to the manufacturer, the strength, and the drug. So when you talk to us, we will give you the NDC so that you can talk to your provider, you can talk to your pharmacy, you can even talk to the manufacturer at an NDC level, and you can diminish your chances of making mistakes. Another pearl here is when you ultimately get the medication, if you notice that the tablet looks different, look at the NDC to check. If you notice that it is not exactly the NDC that maybe we had given you, please check. If you notice that it's not the NDC that the manufacturer gave you, please check. This is a unique way for you to go beyond just checking the name of the drug to make sure that it's the exact manufacturer that you're supposed to get is what you got. Now, as you see this puzzle of how everything comes together, there is good news. The good news is that in the setting of alpha-gal syndrome, for 76.5 or more than 75% of the time, we can get you a medication that is suitable for alpha-gal syndrome that does not have any animal-derived ingredients or mammalian-derived ingredients. So that is the good news. And we presented this data at the largest allergy meeting earlier this year called Quad AI. And I want to give a public shout out to Quad AI for acknowledging that medications are a problem in the setting of alpha-gal syndrome as well. Now, a common question we get is, are medications a problem? Well, I think patients know that, but what is the data to support that? So also at the Quad AI meeting, we showed that last year, we had a 238% increase in the number of medication inquiries for alpha-gal syndrome between Q1 and Q4. A second piece of data is while there is not enough data, you can learn a lot from the Facebook groups where patients are supporting each other. And there's hundreds of Facebook groups out there. I encourage patients to join them because you learn a lot from it, and it's a great resource network. And thank you to the people that are driving those. But we went through about 1,200 Facebook posts from patients, and we analyzed what are they talking about. And if you look at the bottom part of the pie chart, they're talking about food about 21% of the time, and they're talking about medications about 19% of the time. So the discussion of food and medications is relatively equal, and that gives us a greater inclination that medications are definitely a problem as well. So if somebody is not acknowledging that, you can use some of this data. Some of it was presented at the American College of Cardiology, the pharmacy poster session, and the other one was presented at the Quad AI meeting, the allergy meeting that I was talking about. So there is data to support that medications are an issue as well. Now, the question is, what are the risks? Can they be serious? There is a range of data in terms of the seriousness of it and what percent of people get impacted by medications in the setting of alpha-gal syndrome. We did a survey of about 550 people. About 87% of the responders were female, average age of about 52 years. And what we found was people were saying that 92% of them actually had to modify their medications because of their alpha-gal syndrome diagnosis. Now, note on the chart on the right that all of these people, so because it's a sample size of only 500 people, that all of them were reacting to food, but 75% of them were reacting to having some kind of a reaction to medications, about 20-something% to dental products and personal care products, and the same for vaccines, okay? But an important number for you to know is 50% of these folks had an anaphylactic reaction, which can be very serious and potentially fatal. That is an important thing for you to know. The other thing for you to know is some people have died as a result of medications. And a well-known example is the drug cetuximab. It is known as a biologic. It's made in Chinese hamster ovary cell lines, which I'll talk about in a bit. But there is published reports of people having died as a result of it. Now, one thing I want to acknowledge that it is very hard to prove causality when in terms of, hey, was it a drug-induced or a medication-induced fatality or drug-induced anaphylactic reaction? So it is possible that there is underreporting going on. So you need to be aware of that and just be cautious and be a good patient advocate for yourself as well. So what are the medications, in terms of frequency of animal-derived ingredients in these medications? So I mentioned earlier that it's the inactive ingredients that we often need to be looking at. So in an analysis of the 100 most common oral formulations, they found that 75% of them contained lactose, gelatin, or magnesium stearate, which are all animal-derived, gelatin being the most common one. Magnesium stearate can be from a plant or an animal. So take home point, when you see magnesium stearate, it's not always bad, but it could be, and you need to check. You need to know the source of the magnesium stearate. And some companies do a great job and they'll say magnesium stearate non-bovine, and that means that you are okay. But I looked in the FDA database and gelatin is in over 9,500 medications. Magnesium stearate is in over 33,000 medications. And lactose is in over 25,000 medications. So just to give you an idea that you do need to be vigilant. That being said, people with alpha-gal syndrome are not necessarily reacting to lactose, but lactose can be contaminated with the molecule, and hence you need to be cautious of lactose. Of course, there are other people who have an independent lactose allergy, and some of them are sensitive enough to medications. That's a different scenario, okay? But I do want to point that out as well. Other common ingredients that you should be aware of: anything that has a stearate sounding like a name, polysorbate with a number at the end, glycerin is a common one, collagen, lanolin. Heparin is not necessarily an ingredient. Of course, it's a medication, but it comes from an animal source, and some patients, do have reactions to it. But when you're discussing medications with your healthcare team, it's always a risk-benefit scenario. So I'm not saying that people should never get heparin. What I'm saying is there are alternatives to heparin, but some people may also be okay with heparin, but you need to be aware and you need to have the discussion with your healthcare team. And the last one that I want to point out, again, a controversial one, is drugs that are made in cell lines like Chinese hamster ovary cell lines, often the biologics. They end with a drug that name sounds like MAB, monoclonal antibody, as an example. But biologics are often made in Chinese hamster ovary cell lines. Chinese hamster ovary cell lines at times can glycosylate for the alpha-gal epitope. So some people can have a reaction as well. But many people have had success with biologics as well. It's also a case-by-case discussion that you need to have with your provider. And sometimes they do it in introducing the medication in the healthcare facility. Yes, it's cumbersome, but your safety is important. And that way you will know that you're doing it in a monitored, supervised capacity. Okay. Another thing to recognize is a lot of these animal-derived ingredients do have animal-free alternatives, or they're coming from either source, like magnesium stearate. So hence, many options are available. And like I said earlier, more than 75% of the time, we can find you a medication that would be suitable for you. Okay, I'm trying to move to the next slide. Now is quick show and tell, um, just so you can start thinking about common products. For example, Tylenol, very common. Multivitamins, very common. Um, Benadryl, definitely used a decent amount in the setting of alpha-gal syndrome. And the bottom ones too, they're known as antihistamines, Xyzal and Claritin. All of these can have gelatin or lactose in it. But as I said earlier, alternatives are also available. But I just want to give you some examples. But if you see the word gelatin or gel, the red flags should be going on. On the right-hand side, I have some prescription products. Hydrochlorothiazide, which is a common blood pressure medication, in this case has lactose. Some people think, oh, if I just change the formulation to a liquid, it may be okay. Not always the case. Glycerin can be used in there, which can be animal source, so you have to be careful. Of course, I have some inhalers as examples on the bottom. One is a brand, and it has tallow in it, and it's in the device, not necessarily in the drug. So you need to be aware as well. And then another one is an levoalbuterol used in asthma setting. Also, the device has an animal-derived ingredient in them. So we might not be thinking of them, but please do think of these settings. And I'm giving you examples that some of these may not be suitable. This expands that cases of different types of products. I mentioned heparin earlier, but lactated ringers is used in the hospital setting. And in this case, the bag has animal-derived ingredients. And then I'm going in the top column right now. I have some sutures and dental products, and they can have tallow or some unknown animal-derived ingredients as well that stated by the manufacturer. Vaccines on the far right often have animal-derived ingredients in them, but many alpha-gal patients have had success with vaccines. So please have a discussion with your healthcare provider. It is not an absolute no. Okay. Now, yes, there are many vaccines, if not a lot of them, have animal-derived ingredients in them. But as I was even showing earlier, that maybe the concentration is lower in vaccines, that the percent of people reacting to vaccines was lower from our small data of 500 people. But the take home is not all vaccines are a no. And then on the bottom, I have some products that are used to stop bleeding, and they can have any animal source in them as well. Now we celebrate on the fun side and success side. At Vegan Med, we are also at our Pill Clarity. We're also certifying products. And if you see this type of a logo on them, on multivitamins, healthcare products, beauty products, on the bottom right is a great example of diphenhydramine, often used in the setting of alpha-gal syndrome, that has no animal-derived ingredients in them. Aspirin, and they're both certified. So we know that we're working with the manufacturer, and we are sure that there's no animal-derived ingredients. On the right are common products like atorvastatin, doxycycline, often used in the setting of tics, and levothyroxine, used for thyroid issues. A very common inquiry that we get. A lot of these we have solutions for that have no animal-derived ingredients in them. Moving on, this shows you the diversity of products. I gave you examples of dental products that are not suitable. On the far right of this, you can see some dental products that are suitable. On the far left, people have asked us about knee braces, electrodes when you're getting an EKG done, some dressings in the second column, and then, of course, sutures is something you have to be careful around, and also certain glues used in dermatology. Of course, certain valves in cardiac surgery can also be animal-based. So this shows you the diversity of products that you need to be aware of. Absolutely, I want to talk about the common classes of medications that are used in the management of alpha-gal syndrome. There's no treatment for alpha-gal syndrome, but we can manage it. Of course, epinephrine people should be carrying. Then antihistamines and corticosteroids, these are available as generics, all three of these. And products are available without any animal-derived ingredients in them as well. On the far right, I want to give a special shout out to a product, Xolair. It is not indicated for alpha-gal syndrome. It is indicated for food allergies. It is considered a biologic. But many patients in the setting of alpha-gal syndrome, and our data suggests maybe more than 80% have had success with Xolair. Some people have reacted to it, so it's not for everyone, but it is an emerging drug that can be used, off-label in the setting of alpha-gal syndrome, or on the label being in the setting of a food allergy. Okay, so these are at a high level, just talking about the types or classes of drugs that your provider may be using, particularly for patients who are trying to manage alpha-gal syndrome. I want to give hone in on epinephrine, because a lot of people have fears around epinephrine and injecting themselves, and that is real. I want to acknowledge it, but there are newer products in the market as well. Of course, there's the classic EpiPens on the left, but there's a product out there called AviQ, which has a nice voice recording that goes along with it, that makes the experience of injecting yourself a lot smoother. And it's a nice credit card sized device, easy to carry. And if your insurance covers it, that's a great product for you to have as well. And the newest in the market is a product called Neffy. It's a nasal spray, so no needles. And this can be great for kids or people that don't like needles. Of course, you'd have to go through insurance as well for that, and maybe a little bit harder than the classic EpiPen. And I want to acknowledge the financial challenges around that. But when you talk to your provider, and they can do the dispense as written, they can do something called working on prior authorization forms, you may be able to get access to these drugs and get them across insurance as well. Of course, medical ID bracelets is something that can save your life. I highly recommend it, and there are many places you can get some. Now, what I haven't talked about is an ingredient called carrageenan, which is not mammalian derived. It is actually coming from red seaweed, but many patients react to carrageenan as well. So I've given two simple examples here. On the left is a toothpaste. On the right is a drug called Pradaxa. And you can see in the ingredients, both of them say carrageenan. If you're somebody that reacts to carrageenan, you want to keep an eye out for that, and maybe you're reacting to that. An interesting thing about the drug Pradaxa that I'm talking about here is a brand name, and it has carrageenan in it, but now it is also available as generic, and some of the generic manufacturers do not have carrageenan in them. So you can get that drug without the carrageenan in it. So that's a great example. So quick reminders. Remember, there is brand name and generic name, but essentially the efficacy for the drugs should be the same because the active ingredient is the same, okay? The concern comes around the safety, because the inactive ingredients especially need to be questioned in the setting of alpha-gal syndrome, okay? But brand name and generic, you can expect the same response if your pharmacy is changing it. But from a safety standpoint, you need to be a patient advocate, talk to your doctor, talk to your pharmacy, so that you can get the right patients that's suitable for you. And I gave the example of Lipitor and atorvastatin. Pushing forward, another reminder is there's active ingredients and inactive ingredients. Active ingredients are the ones that are really driving the clinical benefit. The inactive ingredients are usually used for the formulation, stability, appearance, preservation, multiple other reasons. But those are the ones that we care about, because both active and inactive ingredients could be mammal derived. So when you pick up an over-the-counter product or a drug that has been packaged in that orange bottle for you, don't just look at the active ingredient. Find the full document and look in the fine print for the inactive ingredients as well. I just want to reinforce this message. And of course, I talked about the NDC code. The NDC code will really help you out to minimize medication errors because of generic name interchanging, manufacturer interchanging. And when you engage with us, please, you can reach out to us and say, hey, can you tell us about this NDC? And we will always tell you in the setting saying, hey, here is the drug that may be okay for you, and here is the appropriate NDC. And the reason that matters is that you can be very specific with your pharmacy or your provider so that mistakes don't happen. Okay, so remember NDC. So a lot of people know about and talk about DailyMed. DailyMed is a wonderful government resource of all the medications in the country on their website. Okay, I think this is a great resource for you to go and use and yourself check what are the active and inactive ingredients in my medication. And they also have it by NDC. Here is the slight concern around the DailyMed platform. There was an independent study done where they looked at 100 formulations in the DailyMed database, and they compared it to the structured product label, which is given by the manufacturer. And as you see on the bottom line of the slide, that 39% of the formulations that they examined had internal inconsistencies. So please go beyond just checking on DailyMed. If DailyMed says there's gelatin or something like that in there, then of course, you can be okay saying, I'm not going to take this medication if it's appropriate for you. But don't just rely on DailyMed, even though it's a great resource, for absolutely being sure that you should take that medication. Ideally, reach out to PillClarity or reach out to the manufacturer, but take that extra step because there's some data that suggests that DailyMed may not always be accurate, but it is a great resource. Now, I think one of the best ways to know what is in your medications is to call the manufacturer, the gold standard, okay? Because why? They are making the medication, okay? They can go down to the exact lot number and give you details if you want. While this is an incredible resource, there's a few things that I want all of us to be aware of. One is, don't just call the generic 1-800 number. When possible, look for the word Medical Information Center, because that will get you exactly to the people that you want to be talking to. Okay. Now, in a small project that we did where we called the top 20, manufacturers out there, they were able to help us with the correct answers 60% of the time. And this is published. And what that means is 40% of the time, they were not able to give us an adequate response. I think that these folks who are answering the phone call are well-intentioned, but sometimes mistakes happen and they can be fatal. And that is why I am saying that also do your due diligence. You have checked DailyMed, and now you're talking to that person on the other end of the phone. Ask them, saying, hey, I see magnesium stearate in there. Are you sure that this is a plant-sourced magnesium stearate and not an animal-sourced magnesium stearate? And that might prompt that person to say, sir, ma'am, let me double check on that. Those can be the kind of mistakes. Sometimes they might not even fully understand all the ingredients unless that medical information team has done a great job and have an internal letter for people in the setting of alpha-gal syndrome, okay? So I do want to point out that make sure that you know how to ask the questions and you're being thorough when you're calling the medical information center at the manufacturer. On the bottom, I want to talk about another way to reach out to them, which is a lot of them will have an email or an online contact form. This is not published data. It's going to be coming in the future, but essentially, we had reached out to over 100 drug manufacturers for the top 200 drugs, and over a 3-week period, we only got an adequate response for 50% of the time. So is that a method to reach out to them? Yes. Are you going to get a quick response? Not always. But the best scenario is to call them versus emailing or sending them an online contact form. So I'm just telling you everything for the purposes of knowledge, but I'm also mentioning that calling them will get you a response faster, but there are limitations. So be a good advocate for yourself as well. Okay, I want to give you some examples of the kind of issues that can happen even on the drug manufacturer side. And they can give you a nice letter at times, but the letter can be confusing. And here is an example, and I've blinded out what the product is, where it says on the top, no ingredients of animal origin are used directly during the final formulation of this product. Do not stop reading the letter there. Because as you can see, as you read through the letter, it is made in Chinese hamster ovary cell lines. And then right below that, it talks about cholesterol from mammalian sources. So if you didn't read the letter thoroughly and just stopped at, no ingredients of animal origin exist, this could be a problem for some patients. So please read the letters carefully and use multiple sources to be sure. And of course, that is what we're doing at PillClarity as well, to try and do the best that we can to be of service to patients to eliminate the burden of finding the right medications. This is another example where, the response from the manufacturer said it does not contain any animal-derived ingredients, but Daily Med said it had hard fat in it. So that's a contradiction. So you want to ask further and make sure that you have done your due diligence. Then if you can find another product where this kind of discrepancy is not there, then just go with that. But I'm just giving you examples of what has happened and what could happen and how we don't want to be stuck in this scenario. Now here is a win. This is gold standard, and I want to give a shout out to the makers of Furoscix. This is a product called furosemide is the drug. And some people know it as a water pill, pretty commonly used in healthcare. And this device actually has active and inactive ingredients. It has a container. It has an on-body infuser. And we worked with them to have something called a standard response letter. And we're collaborating with pharma companies like these guys to have standard response letters with us that is beyond just animal-derived ingredients. It also includes other allergens so that we can have a central location for all of this information. We had one patient with 37 medications, and we were able to help them in under 30 minutes because many companies are working with us to have standard response letters. And this is the gold standard way of doing it. So this is a win of what we would like to see happen more in the future. So, as I wind down, I want to, remind everybody that the website is pillclarity.org. We helped over 150,000 people last year through our platform. We get thousands of patients individually reaching out to us for medications, may that be 1 or 37 at a time. 5,000 over-the-counter and prescription products that may be suitable for you. And again, this is a free resource to providers, healthcare providers, and patients as well. And this is something that we take pride in trying to help as many people as we can. When you go to the website, if you have a question, you can just ask a pharmacist, as you can see on the button. And on the left, if you want to find an over-the-counter product or even a prescription product, you can use that button. And then if a prescription product is available, if it pops up, then you can ask us and we can give you more information as well. Pretty easy to use. Those are the two main buttons that you will be using. And then outside of that, it's mostly educational, okay? On our website, there's also a database of close to 100 pharmacies that we are working with. So some pharmacies, we have educated them on the alpha-gal syndrome scenario and how to find the right medications. And we're collaborating with them so the alpha-gal patients can be served the right way. So you can use, if they're listed on our website, that we can work with them to get you the medications if you're already using them. If you're speaking to a pharmacy that is not on their website, you can give them our information. We're happy to work with them. But I want to make a quick comment on compounding as well. Compounding is the process of personalizing a medication that is made specifically for you using your specifications. In this case, most commonly, it's going to be, I don't want any mammal-derived ingredients in my medication. Often a challenge with compounding medications is insurance may or may not cover it, or some compounding pharmacies are only doing the cash model. So remember, 75% of the time, we can find you a medication that is suitable and it is already made by a manufacturer. But in the rare setting that is not possible, we can try and help you, direct you to a compounding pharmacy, and you can see if your healthcare provider, the compounding pharmacy, and you can work together to either go through insurance or figure out a cash price. But I do want to acknowledge that this is an option out there, and the word that you are looking for is a compounding pharmacy. Okay, beautiful. This is one of my second to last slides. I want to have a call to action on all these different key stakeholders that are working together to help the patient with alpha-gal syndrome identify the right products. So my first call to action is to the patient. Right now, as the science of alpha-gal syndrome is emerging, please be your own advocate with your provider, with your pharmacy, with PillClarity, with policymakers, with the manufacturer, with everyone. And for those that are already doing it, thank you. You are champions, and we're very grateful for the work that you're doing to move the entire field forward. The second call to action is for pharmacies and hospitals. We need to embrace this patient population because the risk is very real, and in some scenarios, it could be fatal. So I hope that hospital leaders and pharmacies do not ignore patients with alpha-gal syndrome and can take the extra mile to find solutions for this patient population. And for the pharmacies that are willing to help the alpha-gal patient, even at and maybe a slightly lower reimbursement, I thank you, I salute you. And for other pharmacies that are looking for solutions on this topic, we're happy to work with you as well. And that's your call to action, is to embrace this topic and help find a solution, because you are the glue for the patient finding the right medication, which is the pharmacy or the hospital pharmacy that is ultimately giving the medication to the patient. For the healthcare providers, you are our champions, but please let's also work with the patient to help them find the right medications, help them navigate insurance problems, because that is important. Write dispense as written when appropriate so that the patient can get the right medication. Champion within your own hospital system to have the right alert systems in the hospital EHR system, the electronic health record system, so that these patients can be monitored and tracked, and there are right alerts happening so that they get the right inpatient medications that they need. Also, perioperatively, they get the care that they need. So we need more championing there as well. For the pharmaceutical companies, I think more transparency is key. The American Medical Association also has a policy around this. But having the gold standard response letter is the way to go. And we're looking to collaborate. And as patients, when you call the pharma companies, please advocate for yourselves as well. And for the pharma companies, please embrace this challenging condition and helping patients find the right medications. And on the far right, a lot of work needs to be done on the policy front. A lot is happening. Thank you to the patients advocating for themselves. Many states are now making alpha-gal syndrome a reportable condition to the CDC. Many organizations like the Quad AI group are seeing the alpha-gal patient and recognizing that medications are a problem as well. And they've talked about it on their website. And many others, like the pharmacy organizations, the cardiology organizations, and others are now engaging on this front as well. There are many people in policy making that are engaged on this, and more research dollars are needed so we can treat the condition as well. So more work is needed on that end. And of course, we are here to serve, to try and help work with all of these stakeholders so that we can best help the patient with alpha-gal syndrome and find the right medications so that they can be safe. But my call to action for ourselves is we want to hear from you so that we can better serve you. So please feel free to reach out to us, give us feedback. We may not be perfect, but our intention and our desire to help you is perfect. So we are constantly trying to improve so we can help as many people as we can. Thank you for inviting me to talk to you on this important topic. And I dedicate this topic to all the patients and the champions who are working tremendously hard to make sure that patients are safe on this difficult to manage condition that is not very well understood, that needs more resources. So for all of those that are doing policy work, championing for yourself, helping other patients on Facebook groups, thank you. I will stop here and see if there is an option for questions or if we are at time.
Thank you, Dr. Shah, for that very informative presentation and also for the very important work that you are doing for patients with alpha-gal. I think there are some questions in the chat. Do you want Patrick or I to read them to you, or? That
would be great if you could help facilitate.
Okay.
I can go through them. I've been kind of reading through them, Liz.
Yeah, go ahead.
Yeah, so one of the first questions was back looking at like lactated ringers and how are we supposed to know if ADIs are in the packaging or in the device? Like how is that disclosed? Or is it required to be disclosed?
Excellent question. That is one of those things that even your hospital may not know about. And that is why we are collaborating with some of the major hospital systems out there, and we need more collaborations so that we can kind of provide a central resource to these hospital systems for such information. We have a direct line set up for healthcare providers and hospitals so that they can get this information super fast, and it's in their system as well. But great question, because that is not something when you're sick in the hospital that you would be thinking about. And even sometimes your healthcare team may not be thinking about it. This would be happening at the hospital pharmacy level. But as more providers know about the packaging, the better care we can provide.
Thanks. I'll just read down the line if that's okay. I mean, if folks have a question on their mind, feel free to unmute yourself and chime in or just type at the end of the chat. But next question was, how often are inactive ingredients checked since they can be changed at any time?
We are checking every 6 months and often every 3 months to kind of make sure that we're getting the most up-to-date information as possible. If we get lots of inquiries for a particular drug, like the example levothyroxine, we are checking even more frequently. When we have a standard response letter, which is the gold standard that I talked about, that is the ideal scenario because that means that the pharmaceutical company is also making a commitment that we don't need to check all the time. We've just made a commitment that we are checking frequently and there will not be any animal-derived ingredients or allergens in that product. So the gold standard to navigate the frequency of checking is a standard response letter, but we are checking as frequently as possible and also practical. And the reason I say this is because if a pharmacy has a product on their shelf, they could be using that bottle for over a 3-month period because they're not giving out all 500 tablets at the same time. So if we have checked that, then that's a reasonable amount of time for them to keep that bottle, that NDC, to be specific. Great question.
Thanks. And another clarification question is the marking, the label certified animal free AF on Pill Clarity, is that includes alpha-gal safe as well?
Thank you for asking that question. That means that it does not contain any animal-derived ingredients. The exception to that will be carrageenan because it comes from a, like I said, plant source. So if you are allergic to carrageenan, when you reach out to our pharmacy team, please tell them, please also check for carrageenan. And when you reach out to us, also tell us that, hey, I have alpha-gal syndrome, but I'm okay with lactose. And that can sometimes help us better navigate you. But when it comes to the certified animal-free, it's for animal-derived ingredients only. So carrageenan would be the exception that you should tell us about or check yourself.
And on that topic, there was a question about how to handle carrageenan versus like cellulose that might be listed in vegan capsules.
So in the particular setting of cellulose, they will sometimes say HPMC capsule, which the C in the HPMC stands for cellulose. That is okay. Okay. Now, if some people, and I say this particularly in the setting of over-the-counter products, where the regulatory oversight is a little bit less, and people can label things the way that they want, and if they're making their own term, like carrageenan cellulose, then I won't take accountability for that when they're creating their own terms or whatnot. But HPMC, you can be pretty sure that it's a hydroxypropyl methyl cellulose. So it's a plant-based capsule, and that has the word cellulose in it too.
Thanks. I still see a couple more questions and then several thank yous coming in. But next question will be, what is the correct or best verbiage to use when asking a manufacturer if a prescription is alpha-gal safe? And is there like an available resource for like a sample email or a script to make a phone call to a doctor or a manufacturer?
Well, thank you for that idea. We will do that for you. Just give us a little bit of time and we'll make that script. And because we want patients to advocate for themselves. So absolutely we can do that. Relative to the first part of the question, here's what I would recommend. Please do tell the person on the phone that you have alpha-gal syndrome. Okay, they may or may not know about it, but at least you have told them, and if they do know about it, that's very helpful. Second, if you can check your ingredients yourself and verify that with the person speaking to you on the phone, based on the ingredients that I just commonly said to you, gelatin, magnesium stearate, any kind of glycerin, polysorbate, right? And just asking them that extra question, saying, hey, are you sure that these are not animal sourced? Then that will help you be extra sure. And ideally, ask them to send you an email as a follow-up in writing so that you can get in writing as well, saying, hey, this medication does or does not have any animal-derived ingredients. And of course, that is the best you can do. I have no reason to say that you should not necessarily believe the manufacturer, but what I have reason to say that you have to push that extra mile to make sure that you're as accurate as possible in getting the information you need for your safety.
Thanks. I'll have two more questions left. I have one about more that came in during the registrations is about advocacy. How can folks advocate for correct labeling on products, and how can they support PillClarity's mission in doing this? How can they encourage the effort?
Yeah, so thank you for asking for that question. We filed a citizen petition to the FDA 1.5 years ago, and we asked for transparency on medications. Unfortunately, nothing has happened. Many people have signed that petition, but others can too. Engaging with the FDA to make this a policy means that we don't need PillClarity maybe. We don't need all these other challenges that we are working with if it becomes mandatory. I would be very happy if it becomes mandatory from the FDA. So, wish list number one, advocacy directly with the FDA to make transparency of animal-derived ingredients mandatory. And remember, I had briefly mentioned that the American Medical Association had also passed a policy like this over 4 or 5 years ago. Second is when you speak to the pharmaceutical company, please ask them to collaborate with PillClarity. And the reason for that is that way we can have the standard response letter in a central place so that when a patient has 5 drugs, 10 drugs, we can give them that information in a more thorough manner instantaneously versus having to call multiple manufacturers, waiting on the phone for 15, 20 minutes, waiting for an email. That is just not practical in this day and age. And third, of course, helping each other and many policy level things that are happening at the state level would be great. But thank you for even offering your support. It means a lot.
I guess last comment here was from a hospital pharmacist, but their concern was how to handle a new patient, the allergy. And specifically, it seemed like the concern was if they don't have time to check all the medications with Vegan Med, or how do they determine if the medication is safe, the one in their hand is safe, if they have like a busy pharmacy and busy and they're in a rush type thing.
Very, very practical question. Unfortunately, or fortunately, fortunately, because there are hospitals out there that has sometimes a team dedicated to solving this. That is incredible. Unfortunately, because it takes a lot of time to do that, right? So the exact question with having a product in your hand. One, you can check Daily Med. Two, PillClarity is your resource because we're collaborating with the hospital pharmacy directly, and we're giving you that information in a direct line. And I believe that it's even faster and better than Daily Med because of the data that I showed around the inaccuracies within that database. And third, of course, is on your own calling the drug manufacturer. Fourth is remembering these animal-derived common ingredients yourself and browsing the ingredient list. And many of the times you will see gelatin, glycerin, etc., and you will know what not to use. So when it comes to what to use is when you're going to do the first couple of ideas that I said, which is PillClarity, Daily Med, call the manufacturer. But checking the ingredient list on the common allergens that are animal derived will help you eliminate a product very quickly. And then when you're using a resource like PillClarity, Daily Med, the manufacturer, that will help you identify what to use. Unfortunately, that is why we exist, is to make it less cumbersome for the entire healthcare system as a whole. So there's not a better answer than that in the current day and age.
One final question came in that seems maybe simple to answer is, if an operation is scheduled and time is needed, how much time is needed to discuss meds with PillClarity before having an answer?
First off, we respond to every patient. That is our goal. So if you don't hear from us, please ping us again. Please email me directly. Our team is very dedicated to helping you. So that's number one. Number two, we have, like I said, a database of close to 5,000 medications. So we can get a lot of the answers to you very quickly. Unfortunately, for some of them, we do have to reach out to the manufacturer and wait for the response time. And that response time can be 1 day or, like I said, 3 weeks. What is ideal is you talk to your medical team as to what products they're using and get that list and plan for at least a week or two to help us give you that information. And I say that loosely. We aim to do this a lot faster than that. But if you had the time and it's a planned procedure further down the road, then definitely take a couple of weeks. Tell us if you need the answer right away, and we'll try and do the best that we can. Many dental places have now worked with us, and we have told them common products that they have now adapted in their clinic. So they have moved from using common animal-derived products to non-animal-derived products, and then that they can do for a long time.
I think that clears up most of the questions. So thank you very much.
I see a comment here from Sharon saying all of us who benefit from the service should be supporting Vegan Med. I want to be vulnerable and actually say thank you to Sharon for saying that and also supporting us and the many other patients that have done that. I don't have alpha-gal syndrome. Many of our pharmacists actually don't have alpha-gal syndrome, but we're just well-intentioned human beings trying to do good. And we're trying to keep the service free, and we need all the help that we can get. So Sharon, you melted my heart for actually putting that in the chat. So thank you. And thank you to all the patients that have supported us, both, by giving us some donation money, but also giving us ideas, suggestions, and advocating for us in the public domain.
Dr. Shah, is there a way to donate? Because I see there was a question earlier about how can we support
Yes,
you?
you can go to the veganmedfoundation.org website and donate on there.
Okay, great. Well, thank you very much for spending this time with us tonight, or this afternoon, depending on where you are. For those of you who joined a little bit late, maybe because of the time difference, this has been recorded, so I will be sending the recording out to everybody on the registration list. So thank you again. Thank you everyone for joining, and thank you, Dr. Shah.
Thank you.